The lecture today is going to focus on correctional treatment and the service provider. So that is the individual who's conducting the treatment. I get a lot of very positive feedback about this lecture because students mention that this is not something that they're often told about or that is discussed in their classes. And it's some of the most important stuff that you need to consider if you're thinking about going into this profession, because it is an incredibly rewarding profession, but there are also a lot of challenges that one needs to think about working with this population. So who generally conducts treatment? We have psychiatrists, who are the individuals who prescribe medication. There are not a lot of psychiatrists on treatment units. There's usually one, for large groups of individuals, and they're called as needed. Psychologists are sometimes the people that design the treatment, that provide the treatment. Again, depending on the facility, there may be more or fewer psychologists. Psychologists at the Ph.D. or Ph.D. level are usually the ones that are overseeing a lot of the treatment and are at higher level positions. You then have various levels of counselors, generally at the MA level, like licensed mental health practitioners who are engaging in treatment, as well as social workers who have master's degrees. We also have psychiatric nurses who provide treatment. In some cases, we have correctional officers. I know in Canada, a lot of correctional officers are the ones who are providing the treatment. So these are people who both work to confine the individuals as well as provide treatment. So there's sometimes some difficulty with dual roles. In the community, sometimes parole officers, especially those who have some mental health treatment, are providing services. And we also have volunteers, depending on the type of service, who can come in and provide various treatment options. So what characteristics do you think would be necessary for somebody to work effectively with offenders? And, these are very important to consider if this is a good match for you and your personality and your type, because there are certain people who can do this work and who love this work, and this is, great for them. Other people, this is more of a struggle and a challenge. So we're going to go over some of the characteristics that research has shown that are most effective when working with offending populations. So in terms of personality, people who work with offenders need to be flexible because things change very quickly. You can have people in your groups with mental illness. You're going to have people who are decompensating. You're going to have a variety of different things, and you need to be flexible with that. But you also have to be genuine. Offenders are very good at reading when people are being fake with them, and so you need to be able to show, both when you appreciate something, when you don't appreciate something, and you have to own kind of your behaviors. But most importantly, you need to be respectful of those individuals because these are human beings. And while there is a power differential because, they are incarcerated and you are not, they are human beings and you should always be treated as such. In many forensic facilities, you address them as Mr. You may have different rules in your group or Mrs. You also have to maintain strong boundaries because of the environment, boundaries can often get violated, and that's when people get into trouble, and we'll discuss that a little bit later on. You have to have good coping skills because oftentimes the population can be challenging. They may give you a hard time, but also you're going to be talking about some really difficult things, so you need to be able to cope well. You also have to have a healthy level of skepticism. I am pretty naive, I will admit that. And when I came into the field, I would believe everything the offenders told me, and then I would go back to their files and I would read, what was the truth, and I would be, very hurt that the guy had just spent 30 minutes telling me complete fabrications and I believed them. So you have to be able to look at, the evidence and have a good level of skepticism. You need to be able to be compassionate because a lot of the individuals in the criminal justice system have had very difficult lives, but they've also made bad decisions. And so you need to be firm when appropriate. If behaviors are not acceptable, you need to be strong with that. Having a good sense of humor is integral, both with your clients, but also, with yourself and your colleagues, because sometimes if you don't laugh, you're going to cry, and sometimes laughter is a good resource. You need to be consistent, so you need to have policies and you have to adhere to those with all your clients. You can't have certain policies with certain offenders because they will catch on to that. And you need to be able to look at things objectively. So sometimes, you will get emotionally involved. That's inevitable. It happens. But you want to be able to take a step back and have people in your lives who can help you with that objectivity. Values and morals are incredibly important because we are trying to teach individuals kind of what is right. They have broken the law, so technically they are in the wrong. And so we need to make sure that we have good values and morals. So we have to believe that people are essentially good, that treatment can be effective, because if you don't believe treatment works, then you're going to get burnt out pretty quickly. I do believe, and the research suggests, that well-delivered treatment to appropriate risk levels does work, as I've shown you in the data. And We have to also recognize that even the worst offender has a strength, and we need to build on those. And that's our job as mental health providers. But we do, and we've talked about this many times, but public safety takes precedence over confidentiality. So if you know that somebody is going to hurt somebody else, you need to act on that, even if you're going to violate the confidentiality of your client, because therapy within a correctional setting, the client is not the offender. It is, the criminal justice system, and therefore you need to break confidentiality with your client, and you have to tell them at the onset of your treatment that there are limits to what you're not going to share every little thing they tell you, but if a lot of the stuff goes into notes, it goes into reports, because people have to know what's being discussed. You also have to think that the victim statement is more valid and reliable than that of the offender, regardless of how, and it may be wrong, but we have to believe, the criminal justice system, we have to believe in the fairness and the good of it, and that once they come to us, that we are treating them for why they are there. And we have to believe that all crimes are wrong and unjust. And even though you may seem, like if there's a statutory rape case where, there's an 18-year-old and a 16-year-old, and he's, you believe that as unfair, you have to recognize that according to the law, that is illegal, and you have to treat it as such. You have to have strong ethics and adhere to the ethics of your profession. If you're a psychologist like I am, it's the American Psychological Association. We have guidelines. There's also guidelines for forensic psychologists that are specific to those working in forensic settings. Examples of unethical conduct are, accepting gifts or bribes from offenders, obviously having sexual relations with offenders, bringing things in for offenders, they ask you to bring in, like selling and buying things for them. Those are all examples of unethical conduct, and you could actually lose your license because of those things. And I know people who have lost their license. Knowledge is also important. This is a field that's new and constantly developing, and you have to be up to date on the current research. What you're learning in this class is kind of what is state of the art, but that's going to be changing, as it's only really been in the last couple of decades that we've started really investigating, offender treatment. So you need to know, have a certain degree of knowledge about theory, assessment, and treatment. You have to get adequate training on those, both through your degree and ongoing treatment. You also have to get knowledge from various sources like clients, their families, peers, and other professionals, as well as journals and books. So you can't just stop learning once you get your degree. You need to continue in learning what's going on. And recognizing that learning is important and integral to you doing a good job, and you'll have a better outcome the more you're able to learn. You also have to have sound judgment, because there's going to be a lot of ethical calls. There's going to be times where you're going to have to make decisions on the fly, and you really have to look at the pros and cons and not act impulsively. You have to make decisions based on reason and fact and not on emotional cues, because a lot of this stuff is people's lives and it can be emotional. And don't be afraid to ask questions or seek out additional assistance. There are people, in your community, so be that a supervisor, other therapists, the warden, whoever there is, that you can ask if you're feeling like you don't know what the answer is. You also have to be able to listen. Oftentimes we don't believe that, people don't believe that offenders have a voice, but they do. And it's important for us to listen. And we have to be able to communicate to our clients, both verbally and non-verbally, through our behavior. So leaning forward, good eye contact, that we care about what they say. The more we can show them that we care about what they're saying, and we can kind of, give that back to them, the more they're going to open up to us and share with us, and the better outcomes that we're going to have. So you're actually doing a service for the community by listening. You want to listen and learn from your clients, but also other professionals. People might have different opinions, and you have to understand how hard disclosure might be for offenders. There might be criminal ramifications, but it also might be that they are viewing things differently because that's their way of self-preserving. They may, if they actually divulge what they did, it might be very hurtful for them. And so you have to understand that, they cannot just tell you automatically. That only comes after, some trust is developed. The therapeutic alliance is something that you'll hear about a lot if you engage in psychotherapy, and that is the relationship between the client and the therapist, and that includes working with offending populations. It is really, there are really three main focuses of the therapeutic alliance. One is that you both agree on the goals that you are working on, and you're working towards moving towards those goals. You have to then negotiate those, how you're going to do that. And then you have to have an equitable and supportive therapeutic relationship in order to facilitate that goal. And you can see that in a correctional setting, that's going to be difficult because it is an inequitable situation. However, that's where a lot of these other things that we talked about, like being human and listening to your client, come. And you want to make sure that in that room when you're with that person, that relationship is as equitable as it possibly can be. You have to acknowledge the limitations that you have, or you're in a position of power, that there is no confidentiality here. And you want to let the client know that, but as much as possible, treating them as if they are important and listening and giving them agency whenever possible. So the therapeutic alliance accounts for a lot of the change in treatment. So regardless of what strategy you use, be that psychodynamic, cognitive behavioral, existentialist, a lot of the change that you're going to see is just based on your relationship with the client. Initially, it was thought that up to 30% of client change was due just to the therapeutic relationship, meaning the relationship between the client and the offender, but more recent research using meta-analytic techniques has shown that to be closer to 7%. However, 7% is not nothing, and it's still very important. And as I mentioned, you have to consider that this is going to be challenging in a correctional environment because of the imbalance. But if you don't have a therapeutic alliance, there's really little chance that your offender is going to disclose anything to you, and they're not going to invest in the program. If they see that you care about them, they are going to start caring about themselves and the program. So you have to show that you care in order for them. And it might take a while for you to gain their trust. It could take, multiple sessions. It could take months. But eventually, if you are consistent and you are there and empathetic and listening, people will open up to you. The focus of the first sessions and the first groups really have to be on that relationship, getting to know one another, understanding, dispelling some of the myths, overcoming resistance. Because if you do that at the beginning, then you'll have an easier time later on. And it's inevitable that your alliance is going to break down. Something's going to happen. You might have to quote unquote tell on somebody who's acting up or who's told you something, and you have to violate the confidentiality, even though there technically is no confidentiality. And that can break down alliance. Or you may see something wrong, you may hurt their feelings, but don't despair. That doesn't mean that you cannot get it again. You really have to understand the underlying relationship patterns and then modify your approach and really understand, why that relationship broke down and work to repair it. I've always been able to repair relationships, and that's where those nonverbal cues can come in. And if people stop coming, or they're kind of giving you the cold shoulder, you want to talk to them and understand what has happened. One of the things that you want to think about, and when you see the word countertransference, you're going to think about Sigmund Freud, but we in cognitive behavioral therapy also use countertransference, but that's the reaction that you get that your client elicits in you, and that's often based on your own learning history. It's inevitable that your client is going to cause feelings in you. There are going to be some people that you really dislike and you don't necessarily know why. There are some things that you're going to talk about that are going to cause an emotional reaction in you. If you've been a victim of sexual violence and you're talking to a sexual perpetrator, it's inevitable that that's going to cause reactions in you. I lost my mom at a young age, so issues surrounding death and dying are always a little more emotional for me. And so these are the things that you bring to the table, and we're human beings, so we're going to bring our own stuff to the table. And so it's really impossible to divorce yourself of it, but you have to be aware of it and you have to know when it's impacting treatment. So if you have a client that's really pushing your buttons, you have to understand why that is, and you have to act accordingly. Because if you cannot provide that client adequate treatment because of something in your past, that maybe you can't deal with people who behave the way he does or who've done the things that he do, you need to address that with your supervisor, and maybe that person can be transferred to a different group or something else. Another thing that's really important in treatment with offenders is maintaining therapeutic boundaries. So you need to kind of define the boundaries of what's therapeutic and what's not. So our goals are to help people, but sometimes if we try too hard to help, we've crossed that boundary and we can get ourselves in trouble. We become unethical, and in doing so, we not only can hurt ourselves, but we can also hurt our client. It's important that we maintain those boundaries, especially when working with forensic clients, because it allows for safe interpersonal relationships between the client and us, like they know what to expect of us and we know what to expect of them. It also defines what is and what isn't acceptable in the therapeutic context. So you need to balance kind of your role as a helping professional with trying to be therapeutic and developing that relationship. And that includes things like disclosure. Like, it's okay to disclose shared emotional experiences. Like, I've also felt upset in cases where, I've lost something that's close to me and I can understand what that's like, versus, going into specific details of a broken up relationship and how your boyfriend said this and how, because that can all be used against you, and that starts to get into, tricky territory. So some principles of maintaining boundaries include being consistent. You want to make sure that rules apply consistently and they apply to everybody in the same way. So for example, I have a no handshaking rule, and I just don't shake anybody's hand. Sometimes it's a little bit awkward, but I've had instances where people have had semen on their hands, or people have had spit on their hands, or people who just don't maintain proper hygiene. And, I don't want to be rude, and I don't want to not touch somebody and touch somebody else. So this way I just don't touch anybody. And I maintain an absence of physical contact. I do not hug, obviously do not kiss. You cannot accept gifts from clients because sometimes there's a feeling that they gave you a gift, you would then have to give them something in return. You want to be as neutral as possible. You want to define your limits of confidentiality, and especially in a therapeutic environment and in a correctional environment, that's extremely important. But you also want to be genuine in your concern, and so don't be fake because that can be noticed. So working with an offending population can have significant impact on clinicians, and there's a big literature on therapist burnout just in general, but specifically when working with offenders. So don't think that you're going to be immune to this, because those people who feel like they're immune to it are the ones that are actually at most risk. Because while we are helping our client, doing that giving of ourselves also has impact on us. So while our work is incredibly fulfilling and we are making huge changes and differences to the community and to individuals, it is draining. And you have to understand how that work affects you, because if not, you can be at risk for unhealthy coping, which then makes you less effective, and you can experience burnout, which happens to a lot of people in the field. You'll see a lot of turnover in different environments if they're not adequately supported. So several areas that are associated with therapist stress, including the emotional strain of counseling, because giving of yourself, like imagine like you're having problems with your spouse and now you have to go and give treatment to other people. So your emotional resources are already taxed out, and now you have to give of yourself to other people. That's really emotionally draining. There's also ambiguity, because oftentimes we don't know what happens with our clients. So we give all of ourselves and we don't know, or we see them come back and we feel like therapy doesn't work. Many people are overworked. They're mandated overtimes. They're given large caseloads. There are organizational policies and politics that do not support treatment. I see this very frequently. People are expected to do a lot with a little. And due to the nature of the population that we work with, we are inevitably going to have difficult clients. Our clients are difficult. That's why they ended up in the criminal justice system. So it's going to be hard, and they're going to be people that are going to give you a really hard time. So other areas that are associated with therapist stress are apathy or lack of motivation of mandated clients. A lot of people have to participate in treatment, and so they may be apathetic, head down, not wanting to engage, which can be frustrating. They view therapy as a means to an end, so they'll get parole if they do treatment. They have no empathy or remorse for the victim, and they minimize or deny their crimes, and that can all be very difficult for a clinician to deal with. We also have, specifically when working with offenders, inadequate support and training. We often get, warm bodies in the room regardless of what training they have, and many people don't have adequate supervision. And so, people feel unprepared to do what they need to do. We also are exposed to inappropriate and deviant behavior, and working in fields like with violent offenders or sex offenders, you can be exposed to degradation, dehumanization, neglect, and abuse. And you'll also hear about the offenders themselves, the stories of their childhoods, which can often be very horrific. And those are really hard to kind of leave in the room. You can also be subject to deviant fantasies yourself, where they can talk about your children, and that can be very difficult to hear, or about their victims. And people actually have PTSD reactions, which is called vicarious traumatization, and where there's an increasing recognition that people who work with people who do these heinous things can be significantly impacted, such as people who have PTSD, that working with and hearing about these traumas repeatedly can cause symptoms of PTSD in clinicians. So clinicians report difficulty sleeping, flashbacks, hypersensitivity, decreased sex interest. And I myself have, experienced some of these things. I've had bad dreams about things that people have told me and things like that. And you have to be able to deal with that and talk about it in supervision and be able to have adequate coping techniques. One researcher who studied sex offender treatment providers found that they reported decreased sensitivity and dulled emotions, increased feelings of anger and frustration as a consequence of their work. They became more cynical. They lost their sense of humor. They started to confront people and their clients more. They became less tolerant. They change their contact with the clients, and they change their social interactions. Now, this is not everybody, but these are some of the consequences, and you need to be aware. And these are also symptoms of depression and burnout. So you have to be conscious of that and how that affects you and your clients. There's also issues of safety when working with offending populations. Like 84% of female therapists felt like their boundaries or physical boundaries were violated. Many felt sexualized by offenders, and I've experienced that. The cat calls walking down. You can feel threatened or endangered by a client, so they can threaten you or your family. And you then start to see kind of violence everywhere. You become hypersensitive to it. And while you may have initially thought the world was a relatively safe place, when you start to work in that environment, you can become much more sensitized to the fact that, there's a lot of danger going on out there. So how do you counteract all that? That's with self-care. You need to eat, sleep, and exercise regularly. You have to try to keep your sense of humor, and that's, sometimes a warped sense of humor that you're going to have with your colleagues. You need to have a support network, both of your coworkers and your family and friends, but you also have to have a good supervisor who's going to recognize when you need a break. And you have to be able to say that you need a break yourself, and it's okay to take a break because this is hard work. And don't cope using substances, because that's just going to lead you down a difficult path. So I hope I haven't scared you away too much. I know these are kind of doom and gloom scenarios, but these are things that you need to be aware of. And as long as you adequately prepare and engage in self-care behaviors, these are things you can cope with. This is a wonderfully rewarding career, but it is difficult. And I want you to be aware of the difficulties and to prepare for those difficulties. And so please reach out to me if you have any additional questions on this topic, because it's a really important topic and one that we need to